On behalf of Hospice of the Piedmont and Hospice of Randolph, welcome to the E-Series, an educational webinar series aimed at engaging our community, exploring relevant topics, and educating about ways to connect with our organization. My name is Ryan Biagini, Director of Community Engagement and Education, and I'll be presenting today's topic, the Hospice Volunteer, Making the Case for Personal Engagement. If you have been following the E-Series these last few months, you have heard from various members of our team covering a number of topics. Our CEO, Trent Cockrum, spoke on the subject Life Matters, walking us through how to have difficult end-of-life conversations and highlighting some myths and misconceptions of hospice care. Our Vice President of Family Care Services, Kat Gibson, educated us on advanced directives and discussed the importance of planning and completing these documents. Most recently, our bereavement counselors shared with us their role in our organization and presented strategies for finding hope and building resilience during the national pandemic we have all experienced these last 6 months. For more information on any of these topics or to view the recorded webinars, please visit our website at hospiceofthepiedmont.org/e-series. Today, I have the privilege of discussing the role of the hospice volunteer. During the presentation, I plan to make the case for why you might want to consider personally engaging with our organization. You will also hear from a current volunteer, Cher Limpak, as she shares with you her story of how she got involved with Hospice of the Piedmont. During today's discussion, if you have any questions, please log them into the Q&A section, which can be found at the bottom of your screen. We will set aside time to address these at the end of the session. You may also choose to log any additional comments in the chat section. Now, when I say make the case for personal engagement, I do mean just that. As I walk us through the acronym CASE, Connect, Advocate, Serve, Engage, my hope is that you will be able to picture yourself in a role personally invested in Hospice of the Piedmont. So let's consider, connect to our organization. This is about you and your experience with Hospice of the Piedmont. Advocate in the community. This is about hospice, the work of hospice, and how it interacts and intersects with our community. Serve, the places and people you value. This is about you and how you choose to invest your time in organizations and in individuals, and engage with your time and talents. This is how we incorporate all three of the above, you, our organization, and the community. So let's get started with the idea of connect. For Hospice of the Piedmont, connecting is mission-centric and essential. It's actually our mission statement. We connect our patients and their family to the care they need on the terms they choose. So what does connecting look like? If times were different and we were all in one room, I might go around the table and ask you to speak to your own experience with hospice, or in particular, Hospice of the Piedmont. Ideally, you'll stick with us, and after this webinar, you'll join us for our next virtual online training, and you'll get that opportunity to share some of your own experience and what might make you sign up for an interest meeting. But in the meantime, we thought it would be worth hearing from some of our team members who have the boots on the ground, who are in the field day in and day out, our clinical staff. And so a few of them gave me a few quotes to just kind of highlight how they have lived out our mission in action. One nurse shared, "I am able to make patients' dreams of passing away at home a reality." The chaplain shared, "I am graced with the opportunity of making a small suggestion to a family member of a patient that changed her entire outlook and offered her freedom from guilt and the questions, could I have done more? And did I do the right thing?" Another nurse shared, "I am honored to be a calming voice, providing guidance on the phone when families are in crisis." One of our social workers shared with me that she's able to leave a lasting impact on her patients and their families through the gift of conversation and life reminiscing during a vulnerable time in their lives. One of our doctors shared, "I help patients and their families understand the changes that are occurring as their disease progresses and to anticipate and prepare for what is likely to come next." One of our nurses shared, "I visited a Hispanic patient to deliver a Spanish version of When Death is Near to his non-English speaking wife. Without a translator, I was able to show support and love to her during her time of sadness." When Death is Near is a resource we provide families as their loved one nears end of life, to give them some signs and symptoms of things to keep a lookout for, and so they're not taken by surprise. And this nurse was able to kind of bridge a barrier of communication with this resource. A social worker shared, "I helped a family with a long history of conflict come together to support their dying loved one. Family dynamics are challenging even at the best of times, but with the tension and the stress of a loved one's end of life, those are just magnified, and our social workers are able to come alongside in those moments." And this last quote from one of our nurses recently shared, "I helped a family virtually connect with their family member over video who was dying from COVID and held her hand for them before she passed." Our nurses, our social workers, our chaplains, they're in the thick of it, and they are oftentimes viewed like family, and they're able to be the support system and lend this extra level of care and love, as evident in this quote and these others shared by our staff. Connection looks different for a lot of people, and I imagine even for some of you, you could share your own story. But while I have share with us, I'd love to have her speak to her experience of connecting with hospice and what that looked like.
Thanks, Ryan. I knew of hospice like probably most or many people do. You just know the basic understanding of what hospice is about. But then when my mother-in-law was diagnosed with lung cancer, it suddenly became much more real to me and to my family, to my husband's family. The way that hospice came in and gave her the support and the care that she needed, and also took incredible care of the family. She was at home, so all the hospital bed and all the things that were needed were brought by, and the staff was just, I was just moved to see how the staff cared as if they were family for our family. And later on, a few years later, my father-in-law also was diagnosed with a lung disease, and we called hospice in again. And in that event, we also had a very similar experience with just the incredible ways that hospice can support and love and care for a family using all the resources available to hospice, but just taking care of a family at one of the most challenging times in our lives, which is the end of life, or caring for another person at the end of their life. So after those experiences, later, a few years later, my children had left the house, off to college and married and working. I had extra time on my hands. And so I started looking in our community for opportunities to give back, to do something that would be significant in the way of serving or helping other people. And my mind went back to hospice. And so I realized that I knew a person who was on staff at hospice named Jeanette. And so I called her and we had lunch together, and I got a really wonderful view of hospice just from having lunch with Jeanette.
Well, I appreciate you sharing your story with us, and we'll come back to you for sure, share. Our best connection to your world is you, and so you welcome us right along. We're going to move on to the A, advocate in the community. And To advocate, you must be informed and know the facts. It sounds like Jeanette was a great resource to you share. We must take the time to educate ourselves in order to be an advocate. This is true for our staff and for you as a community member. We must speak up about what is important. But why advocate? We advocate as an informed community member in order to be able to connect others with programs and services we provide, to educate others on the virtues of hospice care, and to combat the myths and misconceptions about hospice care. Those sound like great facets to employ, but you might be like, I don't know the answers. How am I supposed to combat what somebody might think on the street or a family member in a conversation? Well, we can help with that. We're going to look at a few kind of typical questions that people might ask and give you quick answers that might be helpful as you take these steps in educating yourself as a community advocate. Isn't hospice basically just giving up? No. The decision to seek hospice services is often the most empowering decision a patient or their family can make. Oftentimes it's at the end of making countless expenditures of cost and emotional resources, and reaching out for assistance from a skilled team is not only helpful but wise, and it's definitely not giving up. Who pays for hospice? Medicare is the primary payer for hospice services, but Medicaid and most private insurance policies include a hospice benefit as well. Where is hospice care delivered? Anywhere. Hospice of the Piedmont can provide hospice services to patients and their families wherever they call home, whether that be the four walls of their home, filled with its memories and family, or that be a nursing facility or assisted living center. It could even be an inpatient facility like the Hospice Home of High Point or Randolph Hospice House in Ashboro. Is 6 months the maximum benefit? No. Patients enrolled in a hospice benefit can continue to receive services for as long as their medical condition and prognosis continues to meet federal regulations related to eligibility. So for a patient to be on hospice services, a doctor must say that they have a prognosis of 6 months or less to live, but we have patients that we currently serve that have been on our services for years. And in fact, statistics tell us that a patient on hospice services tends to live 25% longer than a patient not receiving hospice services with the same diagnosis. It's a staggering fact. Is hospice just for cancer patients? Absolutely not. Out of more than 1,000 patients cared for by our organization, only about a third have a diagnosis of cancer. Who can refer someone to hospice? Anyone can, really. Patients can refer themselves, their family members, or other individuals directly involved in the patient's care can refer patients to hospice services. It's really as simple as picking up a phone and calling our office. Does the service end at the time of the patient's death? No. While services provided by the physician, registered nurses, CNAs, or certified nursing assistants, licensed clinical social workers, chaplains, and volunteers, and following the patient's death, our commitment to the patient's family continues with our bereavement counselors, who continue to provide support and services for the next 13 months. So as we think about advocacy, I would love to turn our attention back to Cher and allow her to kind of speak to the value of becoming informed and what that has looked like for her.
So I mentioned to you that I had a lunch with Jeanette, and she was on staff at hospice. She gave me a lot of information, but beyond that, I was still interested in learning as much as I could. And I don't know if that's how you are, but what I do is I get online and I do as much as I can do of my own research to find out. So getting on the Hospice of Piedmont website was really important for me. I was able to find out a lot of information. So after I did that, I also realized that there was a volunteer training coming up, like very soon, within a couple of months. So I was trying to decide, is this something I want to do, or is it not something I want to do? I wasn't sure at that moment. So I called the volunteer coordinator who gave me information on the phone that allowed me some time to think through whether this was going to be a good fit for me. Like I said, I had some time on my hands, and so I wanted to I wanted to be involved in an organization that was going to fit my interests and my skills, and maybe where I could give back in a way that was not only meaningful to me, but meaningful to the people I was giving back to, the patients and the organization. So I decided to sign up for the class, and the volunteer coordinator gave me the encouragement because she said at that time, you can learn a lot just by going through the training. And at the end of it, you can still make your own decision on whether or not this is what you want to do. So I signed up and I learned so much in that class. I learned all about hospice, a lot of what Ryan's just told you. But I also learned what my role might be, how I could fit in, what I could do, and a lot of opportunities that were available for volunteers in this organization. We are, as a volunteer, we are an integral part of hospice. And that was really fascinating to me. So I learned a lot in the classes.
Thanks for sharing, Cher. And speaking to the role of education and the value that comes with just asking a few questions and becoming informed. So as we continue with this acronym and making the case for personal engagement, we'll look at the letter S and serve in the places and people you value. You serve by investing your time, your energy, your resources in that which you value, whether that be an organization or an individuals. And why serve? Again, if we were all together in a room, I would ask you all to go around the table and share what brought you into the room, why you value serving, and how it's looked in your life. And in fact, if I were to ask some of my volunteers this very same question, I'd get responses like, I feel called to do it. I want to give back. It's the right thing to do. Or I'm just a compassionate person, and this is an opportunity to kind of put that to work. But people serve for a lot of different reasons and a lot of different capacities. But there are some significant benefits from serving, and I'd like to share a few of them with you now. A longer lifespan. Over 40 international studies confirm that serving can add years to your life. In fact, current studies suggest up to a 22% reduction in mortality rates. So how much volunteering do we have to do to benefit? Studies confirm that a regular commitment of as little as 25 hours per year is beneficial. Now that's half of what we expect from a volunteer here at Hospice of the Piedmont. So you've got room to volunteer somewhere else as well and really maximize off that. Relief from pain. A study done by Pain Management Nursing reports that on a scale of 0 to 10, that people's pain ratings dropped from nearly 6 to below 4 after attending a volunteer training program and leading discussion groups for fellow sufferers. Volunteering takes our mind off of our pain and also makes us feel more in control of it. A few more happiness. According to Stephen G. Post, a professor of preventative medicine at Stony Brook University in New York, and the author of the book, The Hidden Gifts of Helping, a part of our brain lights up when we help others. That part of our brain that doles out feel-good chemicals like dopamine. According to Dr. Post, these chemicals help us feel joy and delight, a sort of helper's high. When we volunteer, when we serve others, we often give ourselves deeper purpose and meaning, and that nearly always leads to greater happiness. Lower blood pressure. A study done by Psychology and Aging reports those adults over 50 who volunteered for 200 hours in the past year were 40% less likely to have hypertension than non-volunteers. It is believed that it is accomplished because of the lower stress and the effect of being active, social, and altruistic, and reduce in mild depression. A study of alcoholics going through an AA program points out that those who volunteered to help others were twice as likely to stay clean a year later, and their depression rates were correspondingly lower as well. Plus, in many cases, mild depression is linked to isolation. Serving helps to keep a person in regular contact with others and to help develop a social support system. Now, these are all really valid and great benefits, in particular coming out of a pandemic where we've all felt a little isolated. These are really like great selling points. But I do think we need to kind of keep in check our motivation for serving, for helping, for volunteering, and consider who we are serving. There's a difference between self-serving and serving others. According to Rachel Naomi Remen, a doctor who specializes in retreats for cancer patients, we all tend to approach life in three distinct ways: helping, fixing, and serving. We help others when we see them as weak. We fix others when we see them as broken. We serve others when we see them as whole. Now, some of this you could chalk up to semantics, but I think there's something to it. While the first two actions still address the needs of others, we often do them to make ourselves feel better. When we assist people because we see them as weak or as broken, we unintentionally place ourselves above them. Instead of serving their needs, we believe we're doing them a favor by sacrificing our time and our energy. The reality is people see through that, and people that are already in a place of need don't need to be reminded of it by our presence or by even our actions or by our body language. And so there's something to how we view the people we serve and allowing that to kind of form our motivation. I'd love to hand it back over to Cher and have her speak for just a moment on the idea of serving and how that's looked in her life. Cher?
Yeah, I've always kind of considered myself a person who likes to serve. I have a servant's heart, you might say. But I think I've always been someone who likes to give back and fill my time. Your three ways of serving really hit home with me. And one of the things I've learned so much and grown so much is how we serve here at Hospice. But early on in my life, when my kids were little, I would serve at school. I'd be in the classroom and sometimes just helping another child read or making copies for the teacher. But it was a way for me to stay connected with my kids' school, and also a way to give of myself, give back in our community. Eventually, I was coaching their softball teams and working with a lot of students, learning how to play a sport and just being there for the parents as well. I also worked in my church as a volunteer in groups. I led women's groups. We had a couples group that met in our house that I led. And so serving has always been a part of who I am. It's kind of filled in the gaps for me and gave me a place to give of myself in a way that could really help other people. But here at Hospice, serving is about seeing, especially the patients as whole. Their life is so valuable. And we see that as life-giving all the way to the last moment. It is a life-giving opportunity to be present with someone in their room, or as all the nurses, doctors, and CNAs, they give a service that is just valuable. But it's all about giving to a person who is living their life to the fullest. And that's been really valuable to me.
And it sounds like a lot of the motivating factors kind of carried over the years for you, share from, the power of presence for your kids to utilizing your skills and your giftings with coaching. Um, those things are still evident, maybe even in some ways more so here when working with people at end of life. So thank you for sharing. And some of these facts can be found at the article that listed here below. So finally, the E of engaging your time and your talents, incorporating your heart for serving the community and your knowledge of the organization Hospice of the Piedmont. Engage personally with your time, talents, and or resources as a volunteer. Volunteers play a vital role in supporting Hospice of the Piedmont's patients, families, and our mission. Just a few of these important contributions our volunteers make include interacting with our patients and their family, being an informed resource to our community, and providing important internal support to our organization. So as Cher was sharing earlier, she was kind of on the fence about volunteering immediately, but wanted to at least know more. And if volunteering is not for you, to become an informed community member is so valuable, not just our organization, but even to yourself as an individual in the community. So how can I engage with Hospice of the Piedmont? You can understand our programs and our services. You have heard a little bit of them from Cher and I already, but there's our bereavement counseling department. We have a palliative care program. We have our Kids Path program. We have a lot of services, and you'll learn more about them in our virtual online training in the end of this month. Learn more about our grief counseling offerings and suggest them to those in need. Perhaps you have a loved one, or you yourself might benefit from the services of a grief counselor. Know how to make a referral so that you can recommend our services when needed by a friend or loved one. Again, as we talked about earlier, it's as simple as picking up the phone. Request a speaker for your civic club, church group, or professional associations to help educate more in our community about hospice. We have a group of staff and volunteers who are willing to go into different groups, in person or virtually, to share some debunking information of myths and misconceptions. Cher is actually, I might be able to speak to that later. Last, you could become a hospice volunteer. Why does hospice have volunteers in the first place? It's mandated by federal law. Hospice organizations are the only organizations in the entire healthcare system required to have volunteers. In fact, federal law requires that at least 5% of the total patient care hours of all paid hospice employees are provided by volunteers. What do volunteers do for our organization? We have patient and family support volunteers. They go into patients' homes. They go into facilities where patients call home. And in our inpatient units, the Hospice Home of High Point and the Randolph Hospice House. Our inpatient unit support, we also have volunteers who work at a nurse's station and at the front desk as greeters, as a support staff to our paid staff. We have administrative and clerical support volunteers. They help with filing, with data entry, with creating admission binders for our admitting nurses. That list could go on and on. Our clerical volunteers do a lot for the internal workings of our organization. We have transportation volunteers who will provide rides to patients for a doctor's appointment, or help them run errands, maybe pick up groceries, or be a prescription courier to pick up medication and bring them to the door. We have non-contact options for these services as well, which has become especially relevant in the past 6 months. We also have other specialty volunteers that require some additional training, but those include our auxiliary chaplains who supplement and support our paid chaplains over the weekend. At our inpatient facilities, we have volunteers make bereavement calls. We have vigil volunteers and volunteers who are part of our speakers bureau. There are a lot of opportunities for every kind of skill set and temperament that you might have. And a lot of our volunteers do multiple roles. To kind of speak to that, I'd love to, one last time, swing it to Cher and allow her to speak to what this has all looked like for her personally with Hospice at the Piedmont.
Yeah, so I appreciate all the ways that you've listed there of ways that people can volunteer. Lots of areas of interest. That's kind of where I started. I started after my training. I jumped right into being a patient volunteer. So I went into a nursing home facility and visited with 2 different women who were there in different areas of the nursing home. And I was able to go and see them once a week. I can still remember the one woman who really had almost no visitors. Her eyes would light up as I'd come walking down the hall. She just looked so forward to having somebody come just for her, just to sit with her and talk with her. Eventually, she was quite ill and not really able to have a lot of conversation. So I would just wheel her wheelchair around outside in the sun, and sometimes I would paint her nails. She loved having her nails painted, so that gave me a chance to sit with her and have an activity that kept me in touch with her, kept me present with her, and she just really enjoyed that. So sometimes it's not just filling time with lots of conversation. It might just be being present with someone that gives you this incredible opportunity. And so eventually I became involved with the auxiliary chaplain opportunities because I'm trained as a chaplain. So I was able to visit on weekends at the hospice home here in High Point and take on the visiting of the patients, so that because the chaplains visit during the week, and this gives other people an opportunity to come by and say hello and to provide spiritual support to the patients and or the families as they sit and visit with their loved ones. Very rewarding for me, incredibly rewarding to be in a room with a patient or a family at that critical time when things seem to be moving down toward an end, and it gets very stressful and very, very hard. So providing those services was just really, really valuable to me as well as to them. Eventually, I got connected to the bereavement counseling group, the counselors here at Hospice of the Piedmont, and I found a niche in my service that just fit me very well. I still do this. I was encouraged to make phone calls to family members. Usually it happens 6 to 8 weeks after their loved one has died, and the family is just kind of getting through all the craziness really of all the paperwork that has to be done and all that, and they start to settle down into what does life look like. And so having a connection, an actual personal phone call connection with someone from hospice is often very welcomed. And so I just offer my condolences and find out how they're doing, and just give them a chance to talk to somebody who understands that life can be very difficult at this point. But I also help them connect back to our bereavement center, because we have grief counselors and grief support groups that are available to those people who have been involved with hospice, but they're also available to the entire community. All of our communities can come and be involved with a counselor here for grief counseling or be in a group. So I have that wonderful opportunity to share that information with people who've just recently lost a loved one. And I've also been involved with the Care Link, it's called, the organization within hospice that goes out to groups within our community and brings the information to people, maybe a church group or a civic organization, and just answers the questions that what is hospice all about? Why, what can I gain from calling in hospice for my mother, or, you know, what exactly happened. So it's actually just an opportunity to correct information and bring new information for people. It's just a great opportunity to be involved with the community and also still connect to a hospice. And I've also been a transportation volunteer. I drove a very sweet lady to her doctor's appointment, and it was a wonderful visit along the way, but also provided a great service for her. So those are many of the ways. I think there's actually other ways that I might have been involved. When you're here a long time, you find all kinds of things to do because there's tons of opportunities for volunteer here at hospice.
We're grateful for everything you do to share, and we're grateful for you sharing your story with us and how it kind of came full circle to you, you know, giving a part of your life away in a lot of different capacities, looking at that list. So I appreciate you and I appreciate you sharing. Hearing that from Cher, hearing some of this case for personal engagement, maybe you're wondering how to become a volunteer yourself. The first step would be to submit a volunteer application. You can do so online. It's the most convenient and quickest way. You could come in person, but we would encourage you to do so online at hospiceofthepiedmont.org under the volunteer tab. You attend the 3-part training session. It is a 12-hour training course. You'll hear more about that in just a few moments. Complete a background check, get a TB screening, and complete all additional paperwork. Attend an in-person interview with a volunteer coordinator. Complete a supervised clinical competency. That is so that you know what you're doing when you're doing it without somebody next to you. And whether that be with a patient or whether that be working alongside the nurses at the nurses station, we want to make sure you are feeling equipped and valued and ready to do the job. Adhere to all of our agency policies and procedures, and complete a minimum of 12 hours of volunteer work, and complete 12 hours of continuing education annually to maintain an active volunteer status. Our hope in that is, as we view our volunteers as we do our staff, we want our volunteers to feel educated. We want them to feel valued, like a part of the team, because they are a part of the team. They're not a labor force that we send to go do the work that nobody else wants to do. They do work that everybody wants to do, and that's offer support, a listening ear, a kind word, and a warm presence. So we do require 12 hours of continuing education each year. Completing the training course in 2020 makes you, is complete for the rest of the year. So what next? Do you want to better understand our organization's work, mission, and goals? Do you want more resources to become a better community advocate? Do you want to personally engage yourself as a volunteer with our organization? And I invite you to consider attending our first ever actual virtual training volunteer program starting September 22nd with an orientation presented by our CEO, Trent Cockrum. To get registered, you can visit hospiceofthepiedmont.org/volunteer application to complete the online application. We're requesting you to do so before September 15th. We'll then follow up with you directly afterwards to send you a link to our Zoom webinars. It'll all be made available on a private page on our website that you'll have access to, and have access to each of the individual Zoom training sessions. We would also ask that prior to the 22nd, in that week leading up, you plan to make a stop at either one of our administrative offices here in High Point or in Asheboro to pick up a training manual, which would include all of the presentations, as well as the paperwork you'll need to complete to be a volunteer. What does this all look like? Well, this might be a time for you to take out your cell phone and take a quick little snapshot of this picture. We'll also send it to you in an email following this webinar, but I wanted you to take a look and just see what that week of training will look like. Starting Tuesday, the 22nd of September, with that meeting with Trent from 2 to 4. Moving into the following Monday, we'll do a virtual training that'll be broken up into a morning and an afternoon session. There'll be 2 training sessions in each of those segments. So in the morning we'll have 2, in the afternoon there will be 2. On Tuesday, we're asking you to come in person to get your TB shot completed. It requires 48 hours to kind of sit in your system to see to come back for the results to return. And so we'll ask you to come back the following Thursday, the 1st of October. But on that Tuesday, we're asking you to come in to plan for about a 20-minute increment of time. The TB screening portion will take all of 2 or 3 minutes, but we just love to have a 10 to 15 minute sit down with a volunteer coordinator just to hear some of your interest and to meet you in person, because you can only be so personable virtually. We'll complete the virtual portion of training on Wednesday the 30th with a couple sessions that morning, and then we'll wrap up in person on Thursday, October 1st. You can read here and see some of the what that wrap up will include, but we'll take a copy of your driver's license. We'll take a picture of you so that you have a photo ID badge. Here you go. We'll collect paperwork and we'll do a Q&A on our documentation. The goal by the end of this week of training is that you'll have all of your need to know questions answered. Of course, there's plenty of time and space for many more questions to be asked. But we want to do a very thorough job in training and orienting volunteers so they do feel part of the team. Speaking of questions, I would like to remind you all that you can give us, share questions with us now in the Q&A portion. I see that we have one waiting, so I'll just check that here in a moment. But wanted to just give you one last plug for any questions you might have. And that could be a question for me on behalf of the department and the volunteer coordinators, or it might be a question for Cher on behalf of volunteers. So if you have anything in mind that we haven't clarified or you'd like more information on, please type those in now and we'll answer them before we part ways. We have one comment from, actually it looks like a current volunteer who's just really eager to return to his role, and we're eager to have you return. Appreciate you chiming in, Kyles. For the TB test, is there a specific time of day that it has to be taking, looking at work schedule and options? It's a great question, Kelly. And yes, we will provide you with quite a few options throughout the day, starting at 9 in the morning to 5 p.m. We'll send an option, a list of blanks for you to fill in kind of a time slot. And what we will request is that on Thursday, you sign up for a time at least, well, Thursday we'll do in the afternoon, those meetings, because it needs to be at least 48 hours. So you can't be read at 44 hours. So we'll make sure that we sign that set the afternoon on Thursday to accommodate that. But I appreciate you asking, Kelly. If you start volunteering and it's too hard, I'm gonna first let Cher respond to that question, and then I will supplement if necessary. But what do you think about that, Cher?
Yeah, I see that question, and I guess what I'd like to say is there's a lot of interaction between a volunteer and the volunteer coordinator or whoever you're working for. So as you move into whatever area of volunteering you're going to do, if you feel like it's not a good fit, or you feel like, oh, I'm not sure what I'm doing, I don't know if I know everything, there's a lot of opportunity to have interaction with people that you're working with or for. Ryan and I are friends. I can come by his office and just sit down and say, you know, I was thinking this and I'm not sure how I feel about it. And he's personable and he's willing to just talk through. I know there have been times when I was a volunteer for a patient, and I had some questions about being in that home, and so I sat down and talked through it. I think that you'll realize once you become a part of the team that nothing's set in concrete, and everyone is here for support. I feel incredibly supported as a volunteer, not just the training and all the information I got out of training, but the ongoing interaction to help me understand what it is I need to do. So that would be my best answer to that.
Yeah, I think that's great. Better than I could probably say. And I'll also just plug that you'll have access to our volunteer coordinators, Sue Rasso here in High Point and Dawn Stone in Ashboro. And they are incredible and would love to answer questions, and they're your support system. And so if there's ever a moment where you're feeling overwhelmed or just need a break or need clarity, they're there for you. And again, as you heard from Cher's had like worn 6 different hats with us. And so if you're in one role and like, can I try something else? The answer is yes. And chances are we have some sort of need that will fit you. So it's a great question. Amelia asks, how has volunteering been during the pandemic? It's a great question. And for several months, our volunteer department just shut down. A lot of things shut down in our world. But for us, we close our volunteer department for about 3 months, maybe 4 months, from mid-March to July. And thankfully had staff that could kind of help cover some of the needs in the meantime. But as we kind of took our cues from Governor Cooper and the CDC and some of the things that were encouraged to us nationally, we also had really great executive leadership here, really forward thinking and really considerate of the relaunching of the volunteer department in a healthy way. And so really our volunteers are being treated like staff, and that's been no different than pre-pandemic, but we are the same cautionary steps that I'm taking as a director, our volunteers are taking. So they're pre-screening each day before they come in to serve. If a volunteer is to go see a patient, which will be reopening that element of our volunteer department here by the month's end, that family, that patient, and the volunteer will all complete a pre-screening. And so we're just being very cautious. We're taking the proper steps. There's social distancing, there's mask wearing, there's washing hands frequently with soap and water and with hand sanitizer. So we're taking the steps to be healthy and to be safe. It's a great question, Amelia, and if there's more to it than you'd like to hear, feel free to follow back up. Do volunteers have an opportunity to meet one another and create community? I'm gonna again pass this to Cher for a moment, and I'll supplement if I need. But what do you think about that, Cher?
Yeah, I have had an opportunity to meet other volunteers. We gather pre-COVID, but we gather together, the volunteer coordinators in each of our, here at the Piedmont and also in Randolph. We have fun times together. So we get together and do a Christmas party. We get together and meet each other over a meal. Sometimes part of our training includes an opportunity to come and see a movie and have popcorn with each other, maybe once or twice, and once every month or every couple months. And there's lots of opportunity to meet each other. we have a volunteer appreciation dinner every year, and we feel very included in what goes on at a hospice. So I actually know a lot of the staff, but I also know a lot of the volunteers. And so that it works out very well.
I don't think I have anything to add. You know, it has looked different with the pandemic, of course, but the pandemic is not forever. And so our hope is to once again, you know, build camaraderie in person. We have had Zoom meetings as volunteers. It's not quite the same, but it's always nice to see each other's faces and just reconnect, because there are friendships that form when you're serving together. Patrice mentions, I have already filled out a volunteer application. We'll receive an invite for the trainings. If you've already completed an application, we have your email address, and that is how you'll receive the information for the next trainings and the details to come. So that's the first step. If you've already completed the first step, well done, and we'll keep you in the loop for this training that begins September 22nd. Are there any other questions? Does anybody have any follow-up questions to something that was asked that we did not thoroughly answer? I do appreciate you all being with us. I will share one last opportunity. If there's any closing remarks that you might want to share with folks as they consider becoming a volunteer, what would you say, Cher?
Yeah, I think when I was first looking for where I could serve, what organizations in our area were available to me, I did a lot of research to try to sort that out and see, where would I best fit. And I guess I just want to say that being a volunteer at hospice has given me that opportunity. And like Ryan said a minute ago, I've done a lot of things over the years. I've been serving since 2012, and so I've had a lot of opportunities. But I just want to say, whatever your interest is, if it really would be to visit a patient, that's great. But if you want to volunteer by making copies for someone and sitting in an office, that's perfectly fine. That could be your area of interest, and very welcomed and encouraged on every level of volunteering. So it can go all the way from being very involved with a patient to being very involved in supporting the staff that's here and everything in between. So lots of really great opportunities, but see what your interests are. And I expect that hospice could find an exciting and significant way to use your interests.
Thank you for that. I did want to highlight one last question somebody mentioned in the chat section about completing their hours if they can't make one of the set times. Appreciate you mentioning that. All of the training sessions will be recorded, and so you will have access to them outside of the window that they're offered. And we would ask that you would just be caught up by the end of each day. And so if you're going to miss the 9 to 12 on Monday the 28th, they'll be posted on our website, the hospiceofthepiedmont.org website, under resources that evening. And so if you could catch up and be up to date by the next day so you don't fall behind, and so that you're kind of being oriented with the rest of this class. Hopefully that answers that question. Are there any other thoughts or questions before we part ways? Well, if not, I appreciate you all being with us today, and I appreciate you, Cher, for sharing your story, and I appreciate so much all that you do for our organization. I do look forward to seeing you all on the 22nd, and hopefully getting to meet you in person. We appreciate you, and have a great day.